I think that probably the first place that we'll see the blockchain used, the place that it could most easily be integrated into the existing system, is just to replace kind of our centralized data silos sort of storage model that we have now, where a hospital will have a couple databases that hold all of its PHI. And those databases are a significant point of risk for the hospital. And I guess there have been cases of ransomware happening in the past where hospitals have been forced to give up that information or pay a large fee. And with the blockchain, that's not really possible. The hospital isn't even able to divulge information in the blockchain without permission of the patients who are involved. So that kind of ransomware would be impossible.
Yeah. So one of the interesting use cases, so I think definitely anything that comes back to really identifiable and potentially sensitive information almost always leads itself to this conversation of a private chain where what you're storing is a hash to some other data store. But there are some other areas, and this is why I'm so interested in advanced directives and maybe a couple other use cases, is that's information that when anonymized is really just a contract. Just being able to see, account 123 has a do not resuscitate isn't really that unique or that identifiable. But having that available publicly and then reconcilably eventually could be useful and could be public. Because it's not necessarily, doesn't tie you to a particular visit or to a particular diagnosis or problem.
I think another interesting use case is the amount of data that we collect that once anonymized is still highly valuable. So you're looking at what we know is a registry or like a cancer tumor list, that it's fairly arduous to get that data into a centralized repository, and it's very difficult to curate that list because of all the different data points that are entering into it. A blockchain wouldn't need to know the patient name or any identifying features about the patient. This tumor came from a 29-year-old male, would be enough to make that a highly valuable group sourced piece of information. And so to me, the concept of the blockchain, we're all trying, the whole industry is trying to find solutions to these macro problems, right? Like ransomware patient events are 10x higher between 2014 and 2015, and it's higher even this year. And I mean, we're going to be looking for solutions to that. I don't think blockchain is going to solve like that problem for a lot of the reasons that we already brought up. Mm-hmm. But I think buried in that technology, there are some pretty innovative use cases that are going to start out really small at a micro level, and then are going to grow pretty rapidly. And I agree. I don't think it's a trust. We're not solving a trust problem here, but I do think we are solving an accessibility and a group curated problem.